cardiac surgery. So they brought in some hypnotherapists for just the cardiac unit. And everyone who came into Bellevue for cardiac surgery of any kind would meet with the hypnotherapist for about 2 weeks first. And they noticed that pain levels were massively reduced. The instructions could be given so that there was very little bleeding. There was no infection. They could give those kinds of instructions. There was a sense of trust and a sense of anticipation that everything would go well. They built in feelings of comfort, like we're building in here. They built in feelings of trust. They built in direct commands for no bleeding. They built in direct commands for no pain. They built in direct commands for total amnesia for the actual event. And so what they found, just from a cost perspective, was that patients who went through this, the cardiac unit, before they did this, they had records that they could go back and look at, and also compared to other major surgery that was going on in the hospital. It reduced the amount of days that the patients were in the hospital itself by at least a day, sometimes more than a day. So patients were going home sooner. It reduced the cost of anesthesia, because they didn't need to use as much anesthetic. It reduced the cost of pain medication, both before, during, and after the surgical event itself, because they were not in as much pain. They didn't have to use any transfusions, because there was no bleeding. So from a cost perspective, it was very, very beneficial. And the hospital was saving money and freeing up beds. Now, from the patient's perspective, it was a lot more smooth. It was a lot more, not being afraid and not being anxious and everything else, because they knew that they were building a sense of trust and a sense of confidence and a sense of relaxation and comfort, basically, around the event. Okay? Now, only 1 out of 20 can actually, in fact, probably 1 out of 200 probably can actually go through surgery without anesthesia. Okay, that is a very high skill level, and it's not something that really can be taught. You either have it or you don't. But everybody can benefit in these ways from the hypnosis before, during, and after the surgery. Okay?
So how come they don't always do that? How come they don't always have patients that are going to be going through surgery go through a couple of weeks?
That's a really good question. I don't know. Because there's a lot of data out there. I mean, there's hardcore research that says it's good. But they just don't do it. They just do not do it.
Well, isn't it, Derek? And I'm going from this other money problem.
Mm-hmm.
I would think all of that ahead of time is going to be money that's not going to be covered by their insurance or whatever out of their own pocket. And a lot of people might not have that.
It would be covered if it were offered under the medical billing of the hospital itself. It would be covered.
Oh, okay.
Okay, so that's not the problem. It's not the money issue. And remember, they're saving money.
Mm-hmm.
Because even the cost of the hypnotherapy was even after the cost of the hypnotherapy was factored in, they were still saving lots of money. Yeah.
Isn't that a lot like the Lamaze method of childbirth?
Yeah, Lamaze is hypnosis.
Yeah, I
Yeah,
have
so
all
it is.
four. I
And
have
what is
all
it-
four of my babies.
Exactly, and what does it do? It
Lamaze.
triggers. What does it trigger to?
Your mind,
Huh? What does it trigger to specifically?
your soul,
No.
your avatar.
No. What's the one thing you're focusing on? You're breathing. Yes.
Oh,
Okay. Why the breathing? Why the breathing during labor?
it takes
Because-
your mind off.
Well,
of
because
what's going on.
that is something that is always going to be there,
Yeah.
and it's going to change radically through the course of the actual delivery. So that's something that you're going to want them to focus on, because under normal circumstances, the changes in the actual breathing patterns could be very anxiety-provoking. So that's why the Lamaze practice focuses on the
it's
breathing.
a lot about breathing.
Yeah, it's all about breathing and everything else. And the person who's with you is going to help you focus on that breathing whenever you need to have your attention brought back to the
And
breathing.
you have to bring a picture or something to focus on.
Yep. See, exactly. So it's all of these kinds of things,
Yeah.
that is then built into the practice beforehand. Very effective, extremely effective. Yeah, very well designed. I love the Lamaze system. It's a great system.
Yeah,
Speaking,
works.
of course, as someone who has never But from a theoretical perspective, it's really good. Okay, and I do know, I've talked to many, many women who've used it, and it was very effective. Okay? But yeah, theoretically, I mean, just from looking at it from a theoretical perspective, it is really neat. It's really well done. Okay, any other questions or comments?
Is it true that in China they can do major surgery with only acupuncture?
There is some indication that that does take place, yeah, that they can use acupuncture to actually anesthetize and do major surgery. Yeah. And, you know, extending on that idea, one of the puzzles of pain, and that's the title of a book by Ronald A, The Puzzle of Pain, is that pain is not directly related to the nociception of the actual physiological event. Okay, that is, it's somehow, it's not just the nerve impulses, it's all these other things that go into it. So for example, during battle, you can have soldiers who are severely wounded, and yet they feel no pain. They don't even know that they've been wounded until afterwards, until after the event. Then, of course, the pain comes on. With women in childbirth, there are cultures, for example, you know, the Chinese culture, the ancient Chinese culture, not all that ancient. Pearl S. Buck in her book, The Good Earth, describes women out on the farm who were pregnant, giving birth on the, you know, out in the field, you know, picking the baby up, putting it in, and continuing to work, all happening within like, you know, 20 minutes or so. So there are cultures that seem to have trained their young girls that childbirth will not be painful.
No.
So, and they do. They just don't. They do not have the same response as women in Western cultures do. So these are some of the puzzles of pain that we're trying to deal with, even now, because we don't have the, you know, we're still learning about it.
So when they say you have different pain levels,
Yeah,
for
pain
instance,
pressure.
I go to the dentist and I don't have to have all that stuff and they fill a cavity and whatever.
Mhm.
I just, my mind's somewhere else, I guess.
Mhm.
But they keep telling me it's because my pain level is different from the regular person, or is that because I have just chosen to do that instead of having the shot in my mouth? I mean, I just.
Sure, yeah. I mean, you learned that's a good self-hypnotic technique. A very good self-hypnotic technique.
But then they wouldn't let me go through with that when I said I didn't want to, the root canal. They said, you really need to have this. And I'm going, are you sure? So I don't know if it works. If the
On those extreme
the
conditions.
extreme, yeah.
Yeah. You know, it probably would. The surgery that I saw, one of the surgeries that I saw was a hysterectomy.
Mhm.
And about like 3 minutes from the actual completion of the procedure, they were just sewing everything back and, you know, doing the sutures and everything, and they were done with everything else. She began to notice those sensations of tugging and pulling. And so she began to panic. All right, because she was, you know, coming out of the trance state that she had been in for the whole procedure up to that point. And she began to panic, and you could hear it in her voice. And the hypnotherapist, who was also the anesthesiologist, you know, just reminded her that everything was okay, that everything's fine, that what you're feeling is just sensations of tugging and pulling, no pain, relax again, it's almost over. And so he guided her back into it. So I think what they're concerned about is that with the intense level of invasion into the root itself and into, you know, down into the bone, they would be concerned that you would not be able to maintain the trance state. You probably would be able to, okay, because you've done it successfully with, you know, normal kinds of stuff, which are painful, very painful. Okay, now pain threshold, the concept of pain threshold, we, as an experimental, I mean, as an explanatory model, we sort of discarded that because that implies something innate in the person, which just really isn't probably there. I know that if you're really, for example, 2 or 3 years ago, I had a flu that was kind of intense. And I mean, it wasn't just body aches. It was just that kind of a flu, you know. not really a high-grade fever or anything, no nausea or vomiting like that, but it was just really intense body ache. And it kept building and building and building and building and getting worse every day until just putting on clothes or turning over in bed, the sensations of the cloth against my skin were intensely painful. Okay? Because the flu had somehow altered my perception of pain and made these normally non-painful events very painful. Likewise, if you're very tired, things hurt more sometimes than they do if we're alert and everything else. If we're more relaxed, things hurt less than they do if we're really tense. So the concept of pain threshold is an old one that probably isn't accurate anymore. Yeah.
I was just going to tell you about my mother. She's almost 100 years old, and she grew up in the middle of nowhere.
Yeah.
No doctors, no nothing. So they treated themselves. And
Yes.
she's always had the philosophy she's raised all of us kids with, that if you're sick, you feel better if you get up and get dressed and do something. If you have a chance to go somewhere, you go somewhere. And you pretend like nothing's wrong. Don't tell anybody you're sick. And she thinks the worst thing you can say to somebody is, oh, you look tired. Or are you feeling sick? Because immediately you're tired.
Yes.
Or you're sick.
Yes.
And here's this woman, almost 100 years old,
Yeah.
and I take her to the doctor, and they're saying, boy, you're in great shape for being almost 100 years old.
Yeah.
How do you do it? And she says, I don't know. I'm thinking, I know.
Yeah, that's exactly it.
Yeah.
Yeah, and our grandparents, people from that era, they were in fact tougher than we are.
Yeah. And
No
you
doubt,
can-
because they
you
had to
can
undergo.
pretend like you're not sick, and
Yep.
it actually works. Inside, you know that you're not feeling good,
Yeah,
but you don't let anybody else know.
exactly. And also, you keep doing things and don't.
Yeah, if you get
Don't
a chance
indulge.
to go somewhere, go.
Go. Don't indulge
stay
yourself.
home.
Yeah. Yeah.
Yeah.
And that's exactly it. That's exactly it. Yeah.
That was an old cure that my mom did. When bad things happen, it says, she would have us wash the floor.
Oh, okay.
It says get down in the old way.
Right. Oh, on your down on the floor with your hands. Yeah. Oh, yeah. Yeah.
And it was very much your mind, the sadness, whatever was happening, you would find.
Would go away.
Would go away.
Yeah.
But that was, I forgot about that.
Yeah.
Anything tragic or if someone had died or something tragic like this, this is okay, it's time to wash the floor. And we just go down and we didn't even have to be good at it.
Right. Yeah, exactly. Yeah, the objective wasn't to get the floor clean, it was to, exactly, to heal yourself. Yeah, definitely. Yeah, good. All of those are very, very good points. It almost is as if our technology has created this moral hazard out there. Since we have all this technology available to us, we do not rely on self-regulation techniques, which our ancestors would have had to have relied on, because they didn't have all this technology. And so in that sense, there is that moral hazard attached to it, that we just get lazy, And so, good points, Okay, let's stop with the analysis. You can see what's going on here. You can see how embedded commands are there, how we're doing, imagery, how we're doing all of these kinds of things. It's all happening effortlessly, basically, just because of the choice of words that we're using, and even the order isn't that important. Okay? Now, the only other thing that we have to keep in mind when we're doing this is that we need to start off at the beginning in a normal tone of voice. And then almost immediately we need to begin right about here. We need to start talking slowly, more slowly, and we need to soften our voice, because those are analog clues to relax and go into a trance. All right? So our normal tone of voice up here, with your eyes closed, as you begin to relax, you probably noticed that the first thing you notice is how difficult it is to not become aware. Start to slow down and soften the voice. Okay? Now, when I read the script last week, I was reviewing the tape, and I'm used to being like this close to someone. Okay? So it was probably hard for anyone out there to hear me and understand what I was saying, because it was so soft. But if you're that close to someone, that would be enough. Because they'll hear you. Okay? And the softness and the slowness begin to analogically mark out, the slowing down and entering into trance. Yeah.
Can I ask a question?
Sure.
After you go through this, how do you come out of it?
Oh, the instructions are embedded in the back.
Oh, because when you were doing this, I felt myself
Mhm.
relaxing, and
Yeah.
I thought, how am I going to come out of this to go home?
Right. So here we're linking relief and relaxation, drifting down through, which comes to you whenever you allow it to, just as that drifting upwards. So now we reverse direction.
Oh.
Drifting upwards occurs as well. A drifting back toward the surface of wakeful awareness. And then you just sort of drift back up. And that will, pull the consciousness back to the avatar, and bingo, they'll wake up. Okay? In a relaxed, comfortable way. Back to the surface, bringing along with you all those feelings of relaxation. So it's built into the script.
Oh.
So you have the trance induction, which is the very first part. Okay? And then the body of it, where the suggestions and everything are included. And then you have the return to normal wakeful awareness. Okay, trance termination. So trance induction, the suggestions or whatever else you're going to do, and then the trance termination routine. Okay? Now this one actually takes you back up and then back down. Eyes open now. Okay? Before you come back completely, let's go back down again. Okay? And so that helps to give the person experience in control again, moving in and out, moving up and down, in and out of trance more and more easily, so that they get more comfortable with this process of moving up and down. Also, doing this 2 or 3 times will deepen each successive trance state. So if they need to go down deeper because the pain is still too great, just bring them up and then drop them back down, and then up and then down. And each time it'll go a little bit deeper until finally the pain is gone. All right? We can avoid all the pain. This organism is designed to do that. And these kinds of instructions will help it, follow the pathway to where it can do that. It can control all the pain sensations. Okay? All we have to do is take a look at the young kid down in Utah who had to cut his arm. Okay? And he was in a radically altered state.
Did he do that on purpose?
He had to. Remember, his arm was trapped. He was out. He was away from, no one else was there. There was no way to get, he was there. I can't remember how long, 170 something hours, 179 hours, a long time. And he knew that he was going to die right there if he didn't get away. And so, over the course of that, how long would that be? A week? While he was down there, he was working himself up into this particular state to where he could take his very non-surgical knife and cut through bone. And bone pain is among the worst pains you can possibly feel, especially cutting through living bone. So again, the body is able to do this. Animals do it all the time if they're caught in traps. Chew a leg off. So, it's built into the way that the avatar is designed. We're just taking advantage of that ability. And again, we learn how to do this a little bit better. Yeah, under extreme conditions like that, he made it through, he made the right choice. And, we can't even imagine it. I mean, it is beyond our ability to imagine what that was like.
Is that like somebody being under a car and then all of a sudden you can lift up the car?
Yeah, exactly the same kind of thing. Some mechanism allows us, especially with, like one of our children, a loved one there. I mean, boy, it activates all of these abilities that we don't normally use. And yeah, strange things happen like that. I mean, just, simple events, not even, radical events where people's lives are at stake. I play racquetball, and I play at a very high level. And so, I go to all the tournaments, and I see all these top players from all over the country. And there was one match that I was watching, and the racquetball court is 40 feet long and 20 feet wide. And one of the shots put the ball way back towards the front of the court. So the kid who made the shot was now at the back of the court, and his opponent was up towards the front. And it was a defensive shot, and it went up and just dogged down. So his opponent thought he had an opportunity to end the rally right there and score the point. So he was waiting for it. As it came out of the corner, he just barely touched it, thinking that the kid couldn't make it from the back court to the front court in time to get to the ball. So he's right here in the corner, not looking behind him, and he just touches it, and it goes around him and ends up right back here. And he thinks he's won the point. This kid levitated from the back wall to that front corner. I mean, there was no running, there was no nothing. He levitated and ended up, and he caught the ball and killed it off the front wall. And his opponent was so startled by it that he actually reflexively tried to get to the ball, twisted himself up into a knot, and fell flat on his face on the floor. Because physically, it's longer than 40 feet because it's at an angle. But to watch it, I mean, you could have actually seen it on the videotape. He literally levitated and boom. In a millisecond, he was from here to there. And I'm just thinking, wow, okay. So, yes, those kinds of things happen all the time. Those kinds of events happen all the time. We are, greater than we normally are, and we have abilities far greater than we normally use. And so these are some of the pathways that we can get to access those abilities. All right? Okay, let's just go ahead and now just sort of pair up so that the person who is listening to the instructions is looking at that wall, and the person who is speaking the instructions is looking at the screen. And we won't have probably time to go through the whole script, but we'll have time to go through enough of it that you can get the feel for it. Okay, so just go ahead and sort of break up into pairs.
Or you can
And you can use the side screens too, so we're sort of, by ourselves. Okay, and it doesn't matter who you pair up with, whoever is convenient to pair up with. And what we're practicing is, if we're talking, we're just practicing, stopping at the end of each phrase and allowing our voices to get softer and a little bit slower as we go forward.
Practice this ourselves.
Yeah, practice this ourselves, so just pair up with someone.
Okay. So that's not it. It's just like that's not unusual.
One of us is supposed to look that way and the other. I guess maybe.
Let's see, we need to come up here. Bring a chair up here. Okay, and you can practice reading to me.
I won't do it.
I can do it, yeah. And then the only thing is, I'll have to. I won't be looking at that. I'll just, when you reach the bottom of that, just remind you of the screen. Okay? So just go ahead and close. It's not an emotional thing, it's because I can't hear them.
As you begin to relax, you probably notice the first thing is how difficult it is not to become aware of that pain. You don't need to fight your mind, which is always aware of those sensations there for you. Because as you relax, you can begin to discover that each time you relax, a muscle in the arm or leg or your face
Or even
fight
if
your mind.
or a finger.
You don't need to fight your mind. It's how you aware of those sensations that
more
you
deeply
because as you relax,
into
you
that
will begin to
sensation
discover that each time
and
you
more
relax
relaxed and
a muscle
comfortable.
in an arm,
Because there really is no need
or
to
your
make the
face,
effort it takes
or even a
to
foot,
try to stay
or a
away.
finger,
I have a system.
but you can drift down more into the peaks than before, into a sensation there in a more relaxed and comfortable way, because there really is no need to make the effort it takes to try to stay away from that feeling, which almost seems to guide and direct awareness down toward it, more and more into it, as you drift toward
Or
it,
to try to
toward
find
that
that
center
feeling,
of feeling,
which almost
and
seems
as
to
you
allow
allow
direct awareness down toward it, more and more into it. And as you drift toward it, toward that center of that feeling, everything else will allow you to relax more and more. As you begin to discover that it really is a feeling, to let go in that way, to allow yourself to relax every other part of your body, and to drift down toward the very tiniest center of that feeling, the very smallness, the source of it, and then to drift down through that center into a place
into a space of relaxed,
of
letting go,
quietness,
of
of
comfortable
awareness,
relaxation.
down through that feeling, and out
You can drift
into a space
where your mind can drift, the way waves
full
drift
relaxation, where the waves drift,
from one place to
the way
another.
waves drift from one
Let
place to
your
another.
mind go. The waves go back and forth. They get smaller and smaller from one place to the next. As the body relaxes, the mind becomes smoother and
Everything
smoother,
else can be allowed to
able
relax,
to absorb
to relax more
even
and more.
more
As you begin to
those
discover that
events
you
easily
really can let it
and
go in that
comfortably.
way. To allow yourself to relax every other part of your body. And to drift down toward the very tiniest center of that feeling. The very small middle of it. The source of it. And then to drift down through that center into a place beneath it.
Goes till 3.
Of quietness.
Goes till 3, the class does. Okay, let's switch because it's real nice.
And out the other side.
My problem is I can't see the screen and then you
Where the mind will drift, the way waves drift. From one place to another. As the body relaxes and the mind becomes smoother.
If I let my jaw drop, I don't even to absorb events, but just letting my jaw kind of
Even though
drop
it's
down.
just
You don't want my teeth clench, then that helps me relax too. So go ahead and accept
become absorbed with thoughts and images. As the mind reflects to clear mind of the child, the young child, watching a flock of birds as they soar across the sky.
then to drift down through that center into a place beneath of quietness and calm awareness. Hope to fly into the mist, the rhythm of their sound becoming soft.
And fly into the
And
mist,
soft. and softly down in the pilloried place where you rest and down a most comfortable place for child to relax and drift in dreams through the mind. And letting go allows the flow. Soft flowing where the mind drifts free of things far below and seems to soar in the sky as it passes. So smooth and clear that what appears. And what appears instead is the deep blue shine of the warm soft sun, a star from far beyond. It reaches out and provides a warm, soft light. Just kind of stay where you are. Just kind of drift down. Letting go allows the flow and the soft floating upwards where the mind drifts free of things far below and seems to soar in the sky as clear as glass, so smooth and clear that it disappears when you look at it. And what appears instead is the deep blue shine of the warm, soft sun, a star far beyond that reaches out and provides that warm, soft light as you drift down and experience the comfort and learn to feel the sound sleep that your avatar can provide you whenever you relax and allow yourself to drift into a trance. Because your avatar can take you down through that feeling, into a space that's that comfortable place as you relax and allow it to do so just for you. That relief and relaxation, that drifting down through which comes to you whenever you allow it to, just as that drifting upwards occurs as well, a drifting back toward the surface of wakeful awareness as your avatar reminds you to drift up in a relaxed, comfortable way. Back toward the surface now, bringing with you that comfortable relaxation, that automatic changing sensation, even as the mind drifts upwards. The relaxation continues as the mind awakens and the eyes open, but the body remains behind, relaxed. That's right. Eyes open. That's right. That's right. Eyes open. Eyes open.
Following you.
Does that seem to work for you?
I'm sorry.
Yes.
But that's,
Yeah, there's
I
no
know
way.
he says it doesn't make.
I'm not sure what I did. Good idea.
I think it was.
Yeah, yeah.
What happened with me
Oh,
is
well,
I
you
wanted to
have
try to be
printed scripts under normal circumstances.
What?
take all kinds of stuff.
Well, this script, this is based
And so
on
I had my
scripts
husband
in
do
this
it
book.
to me.
Yes.
And I went to a
Yes,
class
it's
and
on.
I speak there and
What do you mean?
All right. To answer your question, it doesn't matter. Okay, you can stop and do nothing, and they would remain where they were, having their own experiences, and then continue whenever you wanted to. Okay, you can't go too slow.
Are you sure that I was the one you're talking?
Okay, there's no way to go too slow in this process. And the more pauses, the more opportunity they have to do whatever they want to do. Okay? And you'll discover that as you practice this, that there's really no wrong way to do this.
That was what?
Um,
Oh, yeah.
For me,
Yeah.
oh, I said that
it worked 2 nights.
there's no way to talk too slowly. So slower is always better. Joanne asked me if there was a way, because it was broken up because I wasn't moving it. Yeah, that's fine. You just repeat, just go backwards, just do nothing. That would be fine too. And they're just gonna stay in that relaxed state waiting for
Yeah,
you.
no, that was.
Good?
Next week, can we have reverse?
Yes, we'll reverse it next week. And would it be easier if I had like a printed copy?
And
Okay, I'll print some copies in next week. That way you can go at your own
down
speed.
the stairs.
Okay? And we'll just continue to work with this script from here until the end of the semester.
And
All right, any questions or comments?
Anyway.
Oh, good.
Get out there, try to get on that Dollar Tree.
Anything else?
You don't want a hard copy.
I can look at it.
I know.
How do we should?
I'd like to find it.
Next week.
And remember that the free bibliography is on at the bottom of this script. All
Oh.
right?
Yeah, you didn't see, she was pushing, she was pretty fast, her hand was down.
Now make sure that you're all awake. I don't want you out there committing crimes, okay? That's right, that's right.
I sort of wanted to say one of my,
That would totally
one of
explain
my
why.
med school classmates
But I
had
can't,
been through a couple of blood results.
I can't focus with her with them. I'm not talking about, she said I'm gonna have your own.
Well, it's not the script, it's they're talking about other
Yeah.
Pressure of OB, you know. I'm sure it's better for me.
Right, exactly.
The usual reaction, I guess,
Yeah.
is
Just, one or two Yeah,
that guy understood. Hey, thank you, thank you.
Yeah, exactly.
Yeah, with me, the line dancing was fun and it's a good workout, but I'm so uncoordinated.
Well, I am.
You know, and so I got my real big guy's gonna fall out of me. And I said, he's coordinated, so I
Oh,
continued.
well, here's
I do it.
this is Sense and Nonsense in Psychotherapy. This is the book that talks about blissful. Okay, so this is the ISU Libraries version. Mine's an electronic copy. So I'll take this back, and if you wanted it, you could just go find it in the ISU Library.
See, this is the,
Yeah, this is the one that talks about blistering and pain management in general. So this has all the
okay, thank you.
all the blistering research. Okay.
Yeah, okay.
So I'll keep it for just a few more days, and then.
Well, write down what it is, because I know it'll be.
Oh, okay, I'll actually do that right now.
And this is here at the.
This is here at ISU's library, so you can just go out and check and see if it's available.
Did you hear what I said? professor of obstetrics. Med school classmates had asked him. He said, I've seen a couple of deliveries and you can yell and scream and private. I mean, sure, it's uncomfortable, but why do they carry on? Because it's said, well, you try to be shit like football.
Yeah, exactly. There we go, there we go.
Yeah, the standard reply I get from women is, no, watermelon.
Right, exactly. There you go.
Why do I still learn?
Oh. You're just a resistant person, that's all. No, did it help? I mean, was it successful a little bit? Was it useful at all?
Oh, yeah.
Okay.
Yeah.
Okay, good. Practice. Keep practicing. We'll see you next week. We'll see you tomorrow, actually.
Yeah, right.
All right, so this is what I have. This is where I'm going. So,
Yes, navigatealliance.org. You don't need any of the passwords. Okay.
I don't need any passwords.
Don't need any of
now.
the passwords. So the homepage would go here. So it's just Navigate Alliance. Okay, so just navigatealliance.org. There's the homepage, and then come over here. Just hold the cursor there.
Okay.
Bring it over to any one of the ones that you want.
Okay.
The analytical hypnosis is right there with all of the PDF. So here's the script. The script is right there. Second from the bottom, general pain management script. Okay, and then if you wanted the audio files, they're here, just under audio.
And those are the ones that you've taped so far?
Yes. No, these are actual meditation and hypnosis scripts. Okay? So they'll teach you how to do meditation and hypnosis.
Oh,
So
okay.
there's like the relaxation for sleep and pain management, and then the others are the meditation files.
So this is, but it's got sound with it?
Yes,
You're
yeah.
doing them
Yes,
yourself?
it's music
Okay.
and MIDI.
Oh, that's good.
Yeah, so it's, okay?
And then I could put those on a CD and just play them?
Yep, put them on a CD or on your MP3 player, or however you want to do it, and just
Okay.
play 'em and
So I'm all new to this stuff, and
Uh-huh.
I have some friends that are going to be doing the class, and I guess I'm going to be the facilitator.
Okay.
So my question is, they have their own laptop. Do they have the stuff that hooks it up for like you put
No,
it on all
this
of
is the
these?
NK laptop.
Oh, it is?
Yeah, so this is always here.
So if they made a PowerPoint, they would have to,
Yeah, just put it on a jump drive is what I do.
okay.
Okay? Yeah, so just put it on the jump drive and then they'll be able to just put it right there. Okay, now, I mean, if they wanted to, if they have the connectors, they would need this kind of a connector here, okay, and a USB port, and then they could hook their own up to it if they wanted to do that. But this is their laptop.
Okay, all right. I think that's all I need.
Okay, yeah, and if they're unfamiliar with all of this stuff, Shirley
Yeah.
will show them how to hook it up in it.
Well, I will be unfamiliar, and so will they.
Yeah, so Shirley will just come and show them exactly how to do it, and
Because there's, anyway, they were asking me about that, and I'm going, I don't know, I just know that my one instructor uses it.
yeah, so that's all here.
Okay.
Yeah, and like I said, this is their laptop. I have used mine, like this one was unavailable for 1 week, so I did bring my own personal one down here and it was fine, but this is always here, so.
Okay, my next question, since you are not familiar, so is there a computer lab if someone wanted to teach a computer class?
That is a really good question. I think there is.
Because I know we had some people that asked for technology type stuff.
Yeah, technology kinds of stuff.
And,
Shirley would know the answer to that question for sure.
okay,
Because I know there's a computer lab here, but I don't know if it's NKA's.
yeah, because I see the signs for it.
Yeah. And I'm just not sure if NKA would have access to
Because I know our eBay one was in here,
it. Mm-hmm.
and I was
Oh,
just.
well, yeah, then they must.
Well, no, our eBay, she just taught from.
Oh,
her
from here,
computer.
right, from her
Yeah,
computer. You guys didn't have
and,
computers.
but,
Okay.
so, I was just trying to think. So is the internet signal like all through the building?
No, this is a hardwired cable there.
Oh, okay, all right,
Yeah,
so
so
that
that-
wouldn't work.
Yeah, that, and so they just need the,
See, I was thinking if they brought their own laptop, they could sit here and go through all the things that we were thinking about teaching, but
Right.
I asked about that. So ask Shirley, okay?